Dr. Steve Bjorn again here from Core Rehab. I wanted to give you some tips and advice about foam rolling. So foam rolling is a great way to do a little bit of some soft tissue mobilization to kind of massage out tight spots on yourself, and it can be super effective. We kind of describe foam rolling sometimes as a love-hate relationship, because sometimes you hate the way you feel as you're doing it because it can be very uncomfortable, but you love the way you feel when you're done because it can really help loosen things up. It can help a lot with anything from knee pain, back pain, shoulder pain, upper back, neck pain. You can foam roll a lot of different stuff. We're not going to take time on video today to go through foam rolling every body part, but we'll demonstrate a few different things that are common places and ways that help a lot of people. So what you're trying to do is find some of those trigger points and some of those tight adhered restricted parts in your muscle and kind of roll on that. When you find a really tender spot, you want to kind of stay on that spot for a little bit and really try to work it out. And then you also want to try to make sure that you're avoiding really bony prominences, like on the side of your hips, there's a bone right there, it's your gradatrochanter. Rolling directly on top of the bone can be more irritating than helpful, or like right on your tibia bone or anything like that. So you want to try to get more into the meat of the muscle. And so thighs are a really common thing, can help a ton with back pain and knee pain. Start off with the quadriceps and come down onto the foam roll. Try to get weight on your elbows and just control your positioning with your core and your elbows, and roll back and forth and try to find the areas. Like for me, there's a little tightness right there. So I'd stay focused on that area and try to do it for a couple minutes, try to loosen up that spot. And there's always variations you can do with anything. Like if it's a little bit higher, a little bit more to the side, you can kind of rotate a little bit so you're getting the front all the way up to your hip flexor, TFL all the way up top here, and get the higher part of your quad and kind of focus on that a little bit. And then you can move down a little bit lower, get into that lower part of your quad. You can turn to the side and get a little bit more along the lateral quad IT band. A lot of people have a lot of issues with their IT band. If they're repetitive lifters or runners or cyclists, it's an area that can really create a lot of adhesions between the quad and the IT band. And rolling here will hurt while you're doing it, but it will help a ton. And if you force yourself to do it consistently, it'll become less and less painful as you do it, because you're freeing that up and getting things to move better on a more consistent basis. One of the things that we kind of compare it to or describe it like is, if you haven't flossed for a little bit and you floss your teeth, your gums might bleed. Well, is that a bad thing? Does that mean you shouldn't floss anymore because your gums bled? Is it a bad thing that you have pain here and you shouldn't foam roll anymore because you have pain here? No, if you continue to floss, your gums will stop bleeding. Just like you continue to roll, it won't be as sensitive. It still may be uncomfortable, but it won't be as painful if you do it consistently, because you'll be consistently giving some health, flossing that muscle and making it feel better and better. So you can roll every part of it by just changing the position of your body a little bit. So more on the side for that IT band lateral quad for knee pain, and then a little bit more towards the front for that front part of the quad. And then another one that's really common and super good is getting kind of the glute piriformis area back here. Helps a ton with both back and knee issues. And this one's much better if you sit on it and try to cross your leg over. And then if the leg that's crossed over, you're gonna open up that hip space a little bit better, and you turn to your side some. So you're really putting a lot of pressure on that hip of the leg that's crossed over. So the one that's crossed over, you're trying to roll back and forth over the hip, and you're trying to find, so like right there's a little bit tender for me, so I try to focus on that spot, let it dig in there. Sometimes you can just sit there and hold it for a minute, let that pressure. You can sometimes feel something kind of a little bit into your leg because that pressure on that trigger points can refer pain up and down your leg. So if you feel a little bit of something going down your leg, but it eases up after you roll off of it, that's a good thing. It's gonna loosen it up and get it moving better. Now if it's sharp, shooting, severe pain, that's not gonna help. But if you're kind of getting a little bit of a referral, can feel something, that's a good thing. You're gonna find that trigger point's gonna loosen up and it's gonna make it better and better. And like I said in the beginning of the video, there's a million different ways that we can roll and a lot of different muscles that we can work on. But that's a little bit about the hip and the thigh. But the principles of trying to roll areas, whether it's your upper back or your shoulder, are pretty similar. You want to try to find those trigger points, focus on those, work on it for a couple minutes consistently, and do that every day to kind of get it to loosen up a little bit. And that's how we roll at core rehab.